remind to record this kasi kayo ang mawawalan. Wait, nasa na ang rooms? Okay, so we'll be having 5 rooms for today. So kayo, ang group 1 would be room 1, group 2, 2, 3, 4, and 5. So I am already creating your rooms now. So make sure din po na people, you will record sino-sino po yung mga magiging members natin. Okay? So the room is already open. See you at around 10:45, 10:50. Okay? See you at around 10:50. Okay, make sure to answer the questions. Okay lang po.
Ay!
Pasok.
Wala.
Oh my God.
La,
Yes.
Grabe naman yung
Ala, ala, time na nagsasalita ako.
skandalosa naman kayo mga bata kayo. Okay. I already told you it's already 10
pala.
minutes. Okay. So let's begin. Group 1, begin. Skandalosa. Skandalosa. Group 1, room 1, followed by room 2, room 3, room 4, then room 5. Room 1?
Ma'am, pregnant mothers are advised not to drink, smoke, or drink alcohol without doctor's advice. This is because smoking and drinking alcohol and taking any medication can harm the fetus. Um, smoking is linked with several health problems in babies, including low birth weight, um, preterm birth, and sudden infant death syndrome. And drinking alcohol during pregnancy can lead to fetal alcohol spectrum disorder, ma'am. So, ayun po.
Okay. Okay, thank you. So your group will have 6 points for Christopher and 4 points to sa member ng bawat rooms. Okay? Let's have room 2. Wait lang. Before the room 2 will begin, make again, kasi hindi naman mamomonitor ng inyong class monitor ang bawat room. After our discussion sa GC nyo po, lahat po ng pwedeng representative, if each group, pakilagay lahat ng names, lalo na yung mga tumutulong, inang ilagay yung names na makaka-receive ng 4 points, tapos yung presenter 6 points. Like for example, room 1, ito yung mga point. Christopher, 6 points. O, Micaela, 4 points. Ayun. O, for example, ganun. Okay? So, kayo-kayo na lang per room ang magko-compute and then post na lang po sa ating group chat. Room 2, let's begin.
Hello po, ma'am. And why are pregnant mothers advised not to smoke, not to drink alcohol drinks, not to take any medication without doctor's advice? The doctor, maybe it affects on the development of the baby. Maybe it may have some complication on the body of the baby. So the doctor prevents pregnant women from drinking alcohol. It because may affect the child in the mother's womb, and his development may be affected. There's a lot difficulties that the mother will encounter if she didn't not follow the advice of his doctor. Thank you po.
Okay, thank you. Again, 4 points for the members of the group and 6 points for Dave. That's true. It might be harmful. Okay, very good. Room 3.
ma'am, why are pregnant mothers advised not to smoke, not to drink alcoholic drinks, not to take in any medication without doctor's advice? In the situation that doctors doesn't allow the pregnant mothers to take those medicines because there's a chance that the baby may not develop, and also it may affect to have abortion because those medicines is not made good to the mother, and there's a chance that when the baby came out, it will become abnormal. It will have
Abnormalities.
abnormalities, and it may had cause any diseases.
Okay, thank you. Very good. Tama. The baby could have abnormalities. Very good. Again, 6 points for Miss Maria and 4 points for the members of the room. Let's have room 3. Room 4. Sorry, room 4.
Good morning, everybody. Why pregnant woman advised not to smoke, not to drink alcohol? Not to drink alcohol, not to take any medication without doctor's advice. So everybody, alam niyo naman na nanay na ako. This
Yeah.
is yung first trimester is the sensitive part of being of being a pregnant kasi dito na develop yung first development ng baby na makakapag-cause ng kahit na ano sa aming mga nanay. I just want to share my experience lang, no po. Just, nung nabuntis ako, bali po, uh, first week pa lang kasi, nagpa-check up na ako. So, the OB, asked me na, are you drinking alcohol, smoking, like that, or are you take medicine? Sabi ko, no lahat. Kasi, in-explain niya sa akin kasi, makaka-apekto talaga yung pag-smoke, alcohol, and even drugs sa pag-develop ng baby. And isa pa is tinanong ako ng OB ko, may history kami ng mga ganito, ganyan, mga ganyan. Kung ano ba, may abnormal, mga ganyan. So lahat, yung doktor or yung OB, aanuhin ka talaga niya. Kumbaga, susuriin ka niya para syempre yung pangangalagaan niya, yung pagbubuntis mo, and especially yung baby. So medication, case-to-case basis. Meron kaming kapitbahay na mataas ang sugar niya o may diabetic. So, nagtitake pa rin siya ng insulin while pregnant. So, sabi nga niya, Doc, hindi ba makaka-affect yung mga ganitong sound? It's case-to-case basis. Kasi maapektuhan talaga yung baby. So, sa stage na to, ito yung unang-unang stage na talagang pag-iingatan mo. Kasi nagde-develop yung baby dito. At ito yung pinakamahirap man stage kasi sa totoo lang yung nagsasabay yung cravings, yung paglilihin nyo, mahirap pero kailangan mo tiisin dahil yun para sa anak mo. So, the best is yung pangalagaan mo yung sarili mo at saka yung pagiging nanay mo, lalo yung mga bawal wag gawin dito sa stage na to kasi dito na de-develop yung baby mo. Yun po.
Okay. Thank you, Miss Glenda. That's a very nice presentation. I think you're part of the you're part of the podcast. Yes, last Saturday.
Yes, ma'am.
Okay, last
Yes,
Saturday.
ma'am.
That's why nakita ko na to ulit. Okay, so you're part of the
Thank you.
podcast last Saturday.
Thank you
Okay,
po.
that's very good. I think the reason why you have a lot to mention because of course you have the experiences. So very good, Miss Glenda. But next time, let's try to speak more in English. Okay? So I know you tried. Siguro nga kasi
Yes, ma'am.
biglang nagsara yung
Ang
room.
bilis kasi. Tsaka po ang bilis ng time. Okay lang po yun.
Okay po, sige. So, 5 points for Miss Glenda and 4 points for the rest of the room. Very good. And let's have, please take note, of course, what Miss Glenda said, especially for the ladies. Okay, so kasi kayo yung magdadala niyan. Okay, let's have room 5.
Good morning. Good morning, guys. We are room 5. This is our answer for this question. Smoking during pregnancy has an impact on your baby and can result in health issues such as a low birth weight, which can be dangerous, a higher chance of getting pneumonia, asthma, or others. And it also increases the chances of your baby passing away unexpectedly while sleeping. And there are several instances where it is prohibited, such as with a pregnant woman's or mother child, so that they are not harmed after they emerge from the womb. It may potentially cause disease in newborns. Therefore, we should seek medical advice first. Ayan po. Thank you po.
Okay, very good. Thank you for mentioning that we must seek medical advice first. Very good. 6 points for Jamie and 4 points for the rest of the room. Okay, so I'm happy because you know many things about prenatal period, and you know these reasons, I think, not just scientifically, but also inexperience. Thank you for for that, Miss Glenda. So very good yung inyong section. And now I think we could proceed. I hope that you've watched the video that I have given you. Gumagalaw po ba yung PowerPoint? Tama?
Yes
Gumagalaw?
po.
Okay, let's begin. Human life begins at conception. So the womb is supposed to be the safest of all places for human development because everything that is in the womb of the mother is very conducive for the fetus, for the growth, from food, for the things that they need. That's why we need to protect our womb, okay, our belly, with everything that we do, ayan, as much as possible, the things that we eat, the things that we do, physical activities, and stress-free activities. Although, I think nowadays, it's hard not to be stressed. And nowadays, it's also important to be very far away for people who have COVID. Syempre, nakakatakot din yan. So, we need to protect pregnant women during this time, okay? This time, especially every single time, okay? Now, the stages of prenatal development is three. There are three stages of prenatal development. We will begin with the germinal period, followed by the embryonic, and then the fetal. So the germinal period is the 0 to 2 weeks. Embryonic is 3 to 8 weeks, and fetal is 9 weeks to birth. Okay? Let us, of course, begin with the germinal period. So, the first trimester tayo. So, we all know that this is when, sabi nga ni Jody Santa Maria, ni Dr. Jill pa ni Dr. Jill, papunta pa lang tayo sa exciting part. Now, I know that for couples that do not want to have a baby yet, hindi yun ang exciting part sa kanila. But for those couples that they are already praying for babies, ito ang exciting part. That they are waiting for 2 weeks, they're waiting and waiting and waiting. Sabi na sana, kailan ba ako magkakaroon ng baby? Okay. So you can see 2 weeks, it is the germinal period. So ano may germinal period? It is the first 2 weeks after the conception. And what happened is creation of the zygote, a continued cell division, and the attachment of the cell to the uterine wall. Now, vocabulary muna tayo so that because this is a little bit scientific, so we need to have a vocabulary enrichment a little bit. So what is a zygote? According to Encyclopedia Britannica, zygote is a fertilized egg cell that results from the union of a female gamete, so egg or ovum, with a male gamete, which is also the sperm. In the embryonic development of humans and other animals, the zygote stage is brief and is followed by cleavage, when the single cell becomes subdivided into smaller circles. Teka lang, naka-record. Okay, naka-record naman. Okay, so as you can see, during the first part, ito yung fertilization. So um, this is the sperm cell and pinipilit nila makapasok dun sa egg cell. So it's, you can see with this one. Okay, ayan yung zygote. Now, blastocyst, according to Britannica, is this the distinctive stage of a mammalian embryo? It is a form of blastula that develops from the berry-like cluster of cells or the morula. A cavity appears in the morula between the cells of the inner cell mass and enveloping layer. This cavity becomes filled with fluid. So the blastocyst differs from the blastula. It is composed of two already differentiated cell types. The inner mass of the enveloping layer. As you can see, ayan, berry-like. Kung si COVID mukhang rambutan, si blastocyst naman looks like a berry. So yeah, it's like a fruit. Now, okay, trophoblast. It's a thin layer of cells that helps a developing embryo to attach to the wall of the uterus. It protects the embryo and forms a part of the placenta. So as you can see, this is the inner cell mass, so embryoblast, trophoblast, ito yon. At ito ang nagiging protection pag naging embryo na ang ating pag napunta na siya sa embryonic stage. Now, this is the germinal period. Okay, so tapos na ang exciting part ng magjowa at mag-asawa. Dito na tayo papasok. So, assuming that they're already done with the things that they did. So, ito na ang ating sperm cell and they meet 24 to 30 hours after fertilization, the sperm and egg cell chromosomes unite. So, ito na sila. Nagkita na sila within 24 to 30 hours after fertilization. That is the first stage. Now, day 2. So day 2, 36 hours, the fertilized ovum zygote is divided into two cells. So dito from this one, nag-meet na sila at naging isa. From day 1 na nag-meet dito, yung kanina din discuss natin, day 2 na, dalawa na ang cells nila. So after that, 48 hours from two cells, it will become four cells. Okay, so another many cell division. Until day 3, 72 hours. From four cells, it will become from four cells, it will become a small compact ball of 16 to 32 cells. We imagine just in day 3, up 72 hours after conception, ito na agad ito na agad ang nangyayari sa loob ng katawan ng isang babae. So day 4, 96 hours hollow ball of 64 to 128 cells. Day 5, 4 to 5 days, the inner cell mass will become blastocyst. So from different small cells in one pack, para na siyang nalulusaw and it will become blastocyst. Now, what's the difference between this one? The blastocyst is still free in the uterus. So gumagala-gala lang siya. Okay? So nandun lang siya, hindi pa siya naka-attach dun sa lining. Then, in 6 to 7 days, the blastocyst will attach to the wall of the uterus. And I think this is one of the reason, this is one of the things that the birth controls are doing. So I just remember, nagkakaroon siya ng lining. As far as I remember, pag nagte-take ng pills ang babae, kumakapal yung lining niya. So hindi na to mag-a-attach. So siguro, I'm not yet familiar with that, but hanggang dito sa day 4 stage, so magkaroon man sila ng siyempre fertile si babae pa din, fertile si lalaki, pero hindi na siya ma-attach kaya mahuhulog na siya. But if the woman doesn't take medical the different medicines for birth control. So ito, the 6 to 7 days, it will attach to the wall of the uterus. Now, 11 to 15 days, the blastocyst invades into the uterine wall and becomes implanted in it. So yun na yung nangyari in 11 to 15 days. Now, as you can see with this one, this is the endometrium. Ayan, yun la. And then this is the uterine cavity. So the uterine mucosa cells, ito yung blastocyst ay na pumapasok siya dito so that it will be very secured. And now for the next, eventually the endometrium grows over. So napapasok na talaga siya dito sa endometrium. Okay? So ayan na siya. Now, Germinal period. Ayan. So as you can see, ganito yung nangyayari sa bata. Implanted embryo continues to grow within endometrium. This one is depicted to 7 to 8 weeks. So there are different site of implantation. So pwede siyang dito, pwede siyang dito. So it depends upon, of course, it's free flowing. So it will just attach na. So as you can see in the figure 22, this one, the blastocyst digests the uterine mucosa and eventually the endometrium grows over the embryo. So kanina, balikan natin, from this big ball, papasok siya dun sa endometrium. The blastocyst will enter and then papasok and then lalo na siya magiging part na siya ng body and of course eventually pag dito mag-grow yung bata. Okay? So you can see a 7 to 8 weeks old the embryo in this one. And the germinal period, the differentiation of cells already begins as inner and outer layers are formed. The blastocysts develop later into the embryo. So, of course, more and more cell division. So, the trophoblast later provides nutrition from the embryo. So, as you can see with this one, ito siya. From different cells, 4 type cells ng zygote, magiging embryo siya, magiging fetus siya, and then eventually, it will become a baby. Okay, now, ma'am, ano ba yan? Bakit may kalapati? Bakit may cross? So I just want to remind you that this is an example of this is a common. Ito sa embryonic period. Kasi imagine kanina, di ba, parang 2 weeks. Dito yung parang medyo many mothers, some of them have already discovered that di ba sinasabi na, I'm 2 weeks pregnant. Parang ganon. And they will result to abortion. And then ito yung mga pinapatay nila ng mga bata. So this is in the embryonic period. So we use this dove to represent how the peaceful, the deaths of these babies. Okay? So embryonic period is the 2 to 8 weeks after conception. So the mast cells will now become the embryo, then the following developments will take place. And yun, the cell differentiation intensifies and the life support systems for the embryo develop and organs now will come to appear. So yan, nagdi-develop na siya. Isa na siyang tao. Kahit mukha siyang alien, it is already a person. As zygote gets attached, the wall of the uterus, two layers of cells are formed. So the embryo's endoderm, ano yun? It is the inner layer of cells and is divided into two parts. Now, it will become the ectoderm. It is the outermost part. It is the sensory receptors. Ano yung sensory receptors? Don't worry, I will discuss it later. So ngayon, yung ectoderm at saka mesoderm, um, ito yung pagkakahati nitong dalawa would become parts of the body. Will become definitely little by little they will transform into the organs of the body. So the mesoderm is the middle layer. Now, the process of organ formation during the first 2 months of prenatal development is what we call the organogenesis. Well, this process was already posted in your MS Teams classroom. I think ito yung sa doc or yung dalawang video na yon um as the organogenesis, the reason why I posted there two, one is for the chicken and one is for the person. Kasi the person hindi masyadong kita. But in the chicken, kitang-kita niyo yung from small. And it is a real thing. So at least you could imagine. Now, let us have this one. So this is the ectoderm. And this is the mesoderm. And this is the endoderm. This is already part of the body. Now, what will happen? Ang ectoderm, they will develop into a nervous system. Aside from that, it will become the skin of the body of the embryo. Ano ba yung mga sensory receptors? It will become the eyes, the ears, the nose, and skin parts like nails and hair. Yung ectoderm yung nagiging ganito. Now the mesoderm will develop into muscle organs, the skeleton, the kidneys, the reproductive system, circulatory system, and the excretory system. And of course, and last but not the least, the endoderm will become the endocrine glands, the lungs, the digestive tract, and the liver. So from this very small thing, after many cell divisions, they will become these organs na. Okay, so that is what happened during the 2 to 8 weeks of. Yan. So now, as the three layers of the embryo form, the support system for the embryo develop rapidly. So nagkakaroon tayo placenta, umbilical cord, and amnion. So as you can see, in the embryonic period, ito yung itsura niya. There is a villi, this one. Umbilical cord, as you can see sa umbilical cord, I don't know if you have already watched birth giving videos. As you can see, di ba ika-clamp nila yung umbilical cord and then kakat nila. When they cut it down, there are two line. May two nerves yan. One is it is the allantoic duct and the second is the yolk sac. So yun yung nandun sa loob ng umbilical cord. Now the amnion, this will serve as the water for the kid, and of course another layer of protection is the chorion. Now, so you can see the placenta. Placenta is the life support system that consists of a disc, ayan siya, this shaped group of tissues in which blood vessels from the mother and the offspring intertwine, but they are not joined. Now, my dear students, I remember there's a I forgot the video, but I saw that, isn't it placenta? Are you familiar with placenta? Yan yung mga babae natin na nagsa-skincare routine. They love placenta. Pwede siyang sabon, pwede siyang iniinom. So there's a video there na parang this is a person, a rich person I think it's from Beverly Hills or whatsoever. Her job is that she converts the placenta into medicine. For example, kunwari, si Ma'am Glenda, gagamitin na kita ha, Miss Glenda. For example, si Miss Glenda, she will go to for example, kapapanganak lang niya. And then, she will go to the shop. So, this shop, pag pumunta siya do'n, yung placenta niya ibibigay nila sa kanya. As in yung placenta galing kay Miss Glenda. Now, this one, lalagyan nila ng food grade color yung placenta. Hiugasan nila, lilinisin nila so that there will be no bacteria and whatsoever, all of the harmful chemicals matatanggal. And then, lalagyan nila ng color. Paglagay nila ng color, ilalagay nila sa isang papel na parang ifo-form nila tapos parang magiging matatatak yung itsura nun. So meron kang paper that will serve as your placenta. Now, after that, the placenta will be processed. Kasi yung placenta, kunwari ni Miss Glenda, pag pumunta siya doon sa shop, pa-process siya, gagawin siyang parang pulbos and whatsoever, and then, ipapasok siya sa gamot. And then, ibibigay sa kanya yung paper na pinagtataka ng placenta. I think naka-frame yun, plus the placenta, which Miss Glenda will take. Okay, iinumin niya yon for her body. So, yun yung ginagawa ng shop na yon. And many mothers, pinatok yung shop niya. Kahit I think it's very pricey, but they did that. She did that. Kasi nga, parang natutuwa sila kasi there are benefits of placenta in the body. So, i-search na lang kung ano. Okay? So, nakikita niyo, di ba, placenta yung mga kung ano-anong nilalagay sa katawan natin para maganda yung ating skin and whatsoever. So, isa yon. Ayan yan, placenta siya. Kaya nga, there's ano before, di ba, yung placenta, galing yan sa tao. Yak, hindi naman. Pero actually, it is true. Now, amnion. What is an amnion? Ang amnion is the bag or an envelope that contains a clear fluid in which the developing embryo develop fluids. So, ito yon. So, amnion. Ayan, yung tubig-tubig-tubig dyan. So, ayan, amnion, tubig-tubig dyan. Okay? Now, fetal period na tayo. So, we're already done with the embryonic period. We are now in the fetal period. It's 2 months to 7 months after the conception. So, ito, iitsura niya na talaga to. Ito, batang-bata na siya. Now, 3 months after conception, the fetus is about 3 inches long and weighs about 1 ounce. Ma'am, gaano ba kalaki yung 1 ounce? Gaano kabigat? Ang 1 ounce would be a pencil. So imagine hawakan niyo yung lapis. Ayun ang 1 ounce. Usually, or a battery. Yun yung 1 ounce. So ganun kabigat ang 3 months na fetus. And it is 3 inches long. Fetus becomes more active, moves its head, face, forehead, eyelids, nose, chin, and can now be distinguished. So may nakikita na natin siya. Meron na siyang, hindi na siya bilog na ano kakaiba. It is a person na talaga. Kita niyo na siya. Upper arms, lower arms, hands, and lower limbs, the genitals can now be identified as male and female. So dito sa 3 months, nakikita na sisilip na, you're having a girl. Ayan ay mga gender reveal natin na mga nakikita sa videos. Next, 4 months. Fetus is about 6 inches, so nagdoble na siya, and weighs 4 to 7 ounces. Gaano ba kalaki yun? Usually, a tennis ball weighs 4 to 7 ounces. The growth spurts occur in the body's lower parts. Prenatal reflexes are now stronger in the 4 months. So now, the mother feels arm and leg movements for the first time. Ayan. So, there's really there's a confirmation of mother, ito, totoo na to, talagang meron ng kamay. Okay, nararamdaman ko na siya. So, this is the 4 months after the conception. Now, 5 months after conception, so kasi laki na siya ng ruler and it weighs close to a pound. So I've searched, close to a pound or some the cereal boxes. So ganun lang siya kabigat, 5 months. The structure of the skin, fingernails, toenails have already formed. Okay, and the fetus naman sa 6 months is 14 inches long. So isang ruler, tas nadagdagan siya ng 2 inch and weighs 1.5 pound. Eyes and eyelids are completely formed and fine layer of head covers the head. So grasping reflex, ayan, nag-grab na siya, is present and irregular movements occur. So para na kayong may bulig sa tiyan na gumagalaw-galaw dyan. So yan, ang 6 months. And 7 months after conception, the fetus is about 16 inches long and weighs 3 pounds. So ang 3 pounds natin, ayan, is an example of single bread toaster. So, ganyan kabigat. Kaya itong 7 months, of course, if you will wear this big na to for every single day sa 7 months from before. Tas ang bigat. Kaya some of them women talaga, they're very tired kasi they cannot sleep. Kasi medyo malaki na yung 7 months. They cannot sleep na nakadapa. Meron there, they do only have just one position na, and then they cannot stand long, but they need to continue to work. That's why we give heavy pregnant women seat sa mga bus kasi nga we know that it's hard na dala-dala mo siya. Okay? Now, let's have the 8 to 9 months after conception. Fetus grows longer and gains substantial weight about 4 pounds. So, ayan na, pinanganak na ang bata. So, as you can see, it is 4 pounds if ever that you have they've already uh, seen an ostrich egg. So ganun siya kalaki. Okay, so I have seen an ostrich egg. It's of course it's big, and we know naman the ostrich is a very big bird. So ganun siya kabigat. Now, the first one of the first questions I ask you before we begin our discussion is why do we have why should a mother do not consume alcoholic drinks and other things? So it is because of teratology. Okay, so we will discuss it now. Teratology and hazards to prenatal development. So what is teratology? Teratology is the field that investigates the causes of congenital birth defects. So when we say congenital birth defects, bata pa lang siya, o nasa sinapupunan pa lang siya, it's still in the womb, iba na. Okay? Ano na siya, hindi na siya pwede. Now, what is teratogen? Teratogen, ito yung cause of birth defects. It is from the Greek word which means Greek word tera which means monster. Ibig sabihin nito, talagang monster kasi hina-harm niya yung hina-harm niya yung baby. So, teratogen ang tawag siya. Now, prescriptions and antibiotics and non-prescription drugs, they are not allowed for the women. So, prescription, ayan yung antibiotics. That's the reason why if ever na may sakit ang nanay, before we even take antibiotics, you will always be asked, buntis ka po ba? When was your last menstruation? And you will compute kasi it will harm the kid. Non-prescription drugs also, the drugs, of course, diet pills, aspirin, and coffee. I know that women could take a certain amount of coffee, but not all. Kaya so imagine if you are a coffee lover and you could only stay awake for that, tapos mawawala sa, it's really hard. Although there are women who still drinks coffee. But again, kagaya ng sabi ni Miss Glenda, it's always case-to-case basis. So case-to-case basis pa rin yan. But still, as a mother, we need to be very responsible. And it's really hard to become a mother kasi mahilo ka, hindi pwede. Hindi ka pwedeng uminom ng gamot. Titiisin mo, magpapahid-pahid ka lang talaga nagpatanggal ng hilo. So, ayan. Now, why? 60 years ago, there is a history of thalidomide tragedy. So, what is that? 6 years ago, December 2, 1961, the sedative drug thalidomide was withdrawn from use in the UK after being on the market for 5 years as a treatment for morning sickness in pregnant women. It had finally been established that the medicine was responsible for babies being born with underdeveloped arms and legs and other malformations. So as you can see, my dear students, ito yung itsura ng mga bata. And it was already only pulled out after 5 years. So ito yung naging cause nila. Kasi, of course, the mother do not like, it's hard for the mother na magkaroon ng morning sickness. Some mothers talaga, they have a very, very strong mental tuloy, morning sickness. And of course, they resulted to drinking thalidomide. So, ito yung nangyari sa mga bata. Okay? Fetal cocaine exposure, neurological effects and sensory motor delays. This was research. So research on animal models demonstrates the fetal cocaine exposure results in neurologic deficits in memory learning. So ayan, ano mangyayari dyan? Pag na-addict sa cocaine si mother, so you will have growth delays, sensory motor development will also be delayed, attention deficits, depressed responsivity to social stimulation. So yon ang magiging problem if there's a fetal cocaine exposure. Now, We also have the psychoactive drugs like nicotine, caffeine, illegal drugs like cocaine, marijuana, and heroin. Now, this is a syndrome, fetal alcohol syndrome, FAS. It is a condition in a child that results from alcohol exposure during the mother's pregnancy. Fetal alcohol syndrome causes brain damage and growth problems. The problems caused by fetal alcohol syndrome vary from child to child, but the effects caused by fetal alcohol syndrome are not reversible. So hindi siya may iba. As you can see, okay, so there, paano natin malalaman ang mga, as you can see, A, B, C, D, E, F, yung mga kids na nakita natin, they are different nationalities, but they are similar. So ano ba ang itsura pag may fetal alcohol syndrome ka? Okay, so first, they have a small head. So let us check. Small head, ayan, medyo maliliit ang kanilang ulo talaga. Now, they also have a low nasal
Ma'am?
bridge. Yes.
Ma'am, na-detect din ba yan sa newborn? Newborn screening?
I think yes, yung fetal alcohol syndrome. Kasi kung physical ang pinag-uusapan natin dito, makikita siya eh. Physical eh. Ibig sabihin, kita siya paglabas pa lang ng bata. Makikita na may FAS yung bata. Especially, for example, you will declare it na nag-intake ka ng alcohol. Kasi kahit yung mga sa Down syndrome, isn't it? Kita nila agad eh. Pag panganak pa lang, there's a certain feature na you know that ay there is may ano siya, 'di ba? Nagiging problem lang sa ibang mga parents is that of course they do not want their kids to have this kind of sickness, this kind of disease, ganun. Kaya hindi nila ina-accept. But physical kasi ito eh. So kita siya. So I think it could be seen sa newborn screening. Eh kasi tingnan mo to, miss. Letter B na kid, this is very young. Kasi ito kasi medyo toddlers na sila, pero ito bata. And they have the same features. So yes, I think it could be seen. Kagaya nito, low nasal bridge. Kita. So hindi lang siya ano hindi lang 'di ba may sabi, low nasal bridge yung kaklase ko, FAS, FA. Wag naman gano'n. Okay. This is a good thing na hindi tayo face to face ano kasi pag nakita niya, ay ganyan si ano, ganyan. Hindi naman, okay? So aside from that, there is a small eye openings. So this you can see, tinitingnan natin isn't it? This is different nationalities. And if ever na they are normal, hindi sila halos magkakamukha. Pero they have the same features. Yung short nose, ayan, very evident, magkakamukha sila. Thin upper lip, okay, kita na, ito kitang-kita natin lalo. Ayan, maliit yung bibig nila dito, upper. Ayan, halos hindi mo na makita yung smooth, yung philtrum nila, hindi mo na makita. Okay? Underdeveloped jaw, although dito hindi masyado, iba-iba sila. Flat mid-face, kaya talagang litaw na litaw yung ano na dito, mid-face. Iba-iba itsura, pare-pareho sila. Epicanthal folds also could be seen. Ayan, same, 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 same. And of course, ayan, small head. As you can see, it could be easily detected. Ayan, fetal alcohol syndrome. Okay, next. Environmental hazards. For example, radiation in job sites. Ayan, X-rays. That's the reason why um you will be always asked, buntis po ba kayo? Kasi bawal kayo sa X-ray. So environmental pollutants, toxic waste, prolonged exposure to heat and saunas and bathtubs. So I think we Filipinos do not have this problem kasi we don't usually go to heat saunas unless talaga medyo ano yun. Pero in typically Filipino, hindi naman. So now, what happens with this one? Of course, there would be problems with the blood, with the circulation. So pwede siyang magkaroon ng deformities, abnormal brain function, and of course, cancer and miscarriage as well. So it will be affected pag nagkaroon ng si mother. Now, other maternal factors such as rubella, the German measles, syphilis, genital herpes, AIDS, high anxiety, and stress, and age, too early or too late. So, for example, you are already to but of course this is case to case basis kasi there are some women na normal naman kahit na 30 or almost 40 na si mommy, nakapagbuntis siya and okay naman sa kanya, wala naman naging problem. But there are some cases na pag too late na over 40s na si mommy or 40s, nagkakaroon ng problem as well. Age, pag sobrang bata naman, I think there also, but hindi siya masyadong evident sa atin sa Philippines siguro because may mga ano mga teenage pregnancy, but still they are being monitored. Now, I think also for factors din for our father naman, pag 40s then they said that pag 40 years old, yung lalaki, there's a chance na magkaka-Down syndrome yung anak. That's why it is really monitored. And that's the reason also why there are some couples, they do not choose to have couple pag they are already over age. Like for example, 50, 60 na sila, tas that's the first time that they meet, and they settle not to have kids because they might have factors, they might have problems as well. Now, Rubella virus, ayan, infection. Ano yung nangyayari? Congenital syndromes, deafness, cataracts, heart disease, intellectual disability, liver or spleen damage. Aside from that, ang HIV naman can result to the transmission. So ang bata may HIV kahit hindi pa siya born. Gestational diabetes, preeclampsia if unmanaged. So if you have HIV, of course, you need to consult your OBs. Ayan. So kailangan tuloy-tuloy ang medication natin. This is also one of the reason why, since you're already a college student, and if you are active, for example, sa sexually active kayo, hindi na natin i-judge. Of course, you have um, our lifestyle. Ayan. Kunwari kayo man po, since ang ang pagiging sexually active doesn't mean that you are married, and we can only see that you are not that we can only start taking ang tawag dito, pregnancy test pag nawalan ka ng mens. 'Di ba 'yun ang ginagawa, especially if you're regular. So, ibig sabihin nakita naman natin the development of this one is hanggang from zero pa lang. So there could be an impact na dun sa bata. That's why if you are sexually active, make sure na you will not take anything so much kasi baka it will affect to the babies, because there are some pregnant women, hindi nila alam that they are already pregnant, and they keep on taking different stuffs, lalo na pag nahihilo kayo. Sabi natin, ay, nahihilo ko, baka inom ako ng gamot. So, baka maka-affect siya sa baby. That's why if you're sexually active, make sure that you're very cautious pa din, kasi we'll never know. Kasi you will only try to have a pregnancy test after maybe pag kunwari first, "Ay, hindi ako dinatnan. Naku, hindi ako dinatnan." So 2 weeks gano'n, dun palang nagte-take. Eh, malaki yung bata dun, medyo nagsisimula na siyang mag-develop. Sabi nga ni Miss Glenda kanina, delikado yung before 2 months. Ayan yung mga delikado. So please make sure din, na you take care of yourself and be responsible. That is the reason why in other countries, talagang ang birth control pills, ang pregnancy test. They also have after morning pill. Kompleto sila ng ganun kasi they do not want to have these things. Inaano nila na parang ah, para hindi siya maging problem. But in the Philippines kasi, we are kinokontra ng mga groups, the church, kasi nga, we always believe that we want to we know that the sex is for married couples. Yun kasi yung ating paniniwala, and that is our tradition, and that's part of being a Filipino, that it's heavily influenced by not just Catholic but other religions as well. Kaya hindi siya talaga pinapayagan. But as a responsible adults that you're engaged, sana po make sure that you're very cautious. The reason why I'm telling you this because you are already grown-ups. Ano na kayo, first year college na kayo. So you are already in legal age. So this is for the boys and the girls as well. So importante yan. Okay? Now, folic acid is very important to mothers, pregnant mothers. And not just for this one, if you are also a breeder like me, so meron kang alagang dogs na binibreed mo, folic acid is also given to dogs, okay? It can reduce the risk of having a baby with a serious birth defect of the brain or spinal cord called neural tube. Now, spina bifida, most common neural tube defect. Ano nangyayari dyan? Yung spine, hindi siya nagko-close. Now, leaving the child with varying degrees of exposed nerves, and of course, pag may mga naka-expose na nerves, there will be lots of problems like mental retardation or paralysis. So, nakakatulong ang folic acid dyan. So, mothers are taking folic acid. Now, paternal. Siyempre si father, meron din siyang need to take account. Father's exposure to lead, radiation, certain pesticides, and petrochemicals may cause abnormalities in the sperm that lead to miscarriage or disease such as childhood cancer. Now, aside from taking, especially those couples who are already planning to become parents, not just the woman, hindi lang yung babae yung nagpapacheck. Hindi lang yung babae yung nagko-condition na healthy, but also the male one. The father also should be responsible about his health if they want to conceive, they want to have a baby na. Kasi pag hindi siya there's a chance that there will be a problem sa baby. Kasi it's both of them. Okay? Yeah. Now we're already done with the unit 1. We now have unit 2. So infancy and toddlerhood. I really like Stormy. She's very cute for me. Ayan. So go to your room. So again, please screenshot this one. You will be given 10 minutes to discuss the question. Paki-screenshot to at saka yung susunod na slide. Make sure to, what do you notice about the size of the head in relation to the other parts of the body as a person grows older? Thus, physical development begin from the top or below, from side to the center, and I want you to explain your answer. Now, students who already discussed a while ago, hindi na sila pwedeng mag-discuss. Let's give a chance to other discussants as well. Now, this is the picture. Make sure to screenshot it so that you could talk about it in your room. Okay? So, I'll prepare your room now. You will be with the same group. Teka, i-assign ko muna si RB. Na-late si RB. Okay, si Ralph Bolivar. So you will be in room 2. Okay. Again, 10 minutes ha? 10 minutes. So don't worry, this time mag-a-announce na ako na, 2 minutes left. Pakibilisan. Okay? The room is already being opened. So you will be back at exactly 11:47. Bye-bye. Okay. Okay, tama ba? Okay, naka-close na lahat na. Now with let's begin with room number 5 followed by 4, 3, 2, then 1. Okay? Room number 5.
Yung from the question number 1, the
Okay?
image the image depicts how the parts of the body diminish as people age. We will notice also that the baby's head is bigger, but it's bigger at first, but as it gets older, it gets smaller po. From the question number 2, the majority of babies develop from the top down. The first thing to work on its head control the neck muscle strengthening. Hand coordination improves as the body grows older, allowing them to pull themselves forward before learning to fall. Yun po.
Okay, thank you. Thank you very much. Let's give 5 points. Ay, 4 points to the room and 6 points for Miss Cristel. Room number 4.
Ma'am, for the first question, our opinion
Okay.
is that the change in the head is not that visible than the changes of the body. The size of the other parts of the body, like the chest, the stomach, the legs, and other parts, are more visible than the growth of the head. The change that is very visible on the head is more on the facial features. But for our opinion, the other parts of the body grows more in size than the head. And for the second question, babies generally develop from the top down. The first thing to develop is head control and strengthening of the neck muscles. Later, coordination develops, which allows a baby to pull themselves forward before learning how to crawl. And then babies begin developing motor skills from the center of the body outward and from head to tail. From the top or bottom, it would be the top, and in the motorcycle, it would be the center to side. At birth, baby's head is relatively large, making up 1/4 to 1/3 of his or her total body length, while an adult head makes up just 1/8. Yun po yung sa amin, ma'am.
Thank you. Thank you very much. Very well said. Let's have 4 points, then 6 points for Miss Bea. Let's have room 3.
Um, from the question number 1, we notice once he gets older or he keeps on growing, their heads are getting smaller, but their heights keep on growing. From the second question, we also notice that babies usually grow from top to bottom. The first development is head control and neck muscle strengthening. Hand adjustments develop later and allow the baby to help themselves or or full themselves to learning how to crawl or to walk.
Okay. Thank you. Thank you for that. Last. Last. Room 2.
Um, Loud and clear po ba ma'am yung audio
Yes
ko
po,
po?
Miss. Yes, J Mark.
For the first question, we see that on the picture that the head of the baby was big and it's not proportion on the body. And according to my members that we tackled earlier, that the it has a development on the body of the baby in each age, like for example in 3 months, 3 years, and it has a development. And we believe that on the second questions that the body was developed through the center, because it's like on the discussion when we start our class about the proximo-distal pattern, that the development of body was start center. So we believe that a baby has a be, we believe that that first to develop is the head, and the body part, the lower part of the body was small. So it has a process or development that grow that the body and the head was become proportion, that we will see on the photo or on the picture. The head and the body was proportion to each other po.
Okay, thank you. Thank you, J Mark. And last, I think J Mark is not the last. Last group, group one, room one.
Yes po. Learning po.
Mm.
In the first picture, we notice that as the child's body grows, the size of his head shrinks or fits his body so that his body can balance the weight of his head. If we're not mistaken, this is the cephalocaudal development that starts from the top of the head and progresses towards the bottom of the body. In the next picture, unlike the first picture, the appearance of child here is much bigger than the first one, but as his body grows older and develops, the proportion of his body becomes normal. And this called proximodistal pattern is also known as the from near to far pattern. This is because it starts from the body part that is closest to the head and progresses towards the body part that is furthest away. Thank you po.
Okay, thank you. Very good. Again, same. All rooms will receive 4 points, and then all presenters will receive 6 points. Very good. I am happy because you're mentioning what we have discussed about the proximodistal development and cephalocaudal development of the body. It is very related to what we are about to discuss. So very good for that you can still remember even those big words. So congratulations to this group. I also like the way you presented all of the five rooms. Nakakatuwa. Even if we always have the connotation with Filipino majors that it's hard for us to speak in English. But please, pakitanggal yung stereotype na yan. Because you should be you should be well versed not just in Filipino but also in English as well. Especially ang gagamitin na we will be using English when it comes to exams, 'di ba? Although your major might be in Filipino, but professional education courses and also general education courses are in English. That's why you still need to speak in English. Even if you are a Filipino major, it will be very helpful for you. So congratulations, all of the presenters. Okay, so let's now proceed. Okay. Now, gumagalaw yung presentation.
Opo.
Okay, thank you. Okay, so have you've already mentioned the cephalocaudal trend? It is postnatal growth from conception to 5 months when the head grows more than the body. Okay, infants learn to use their upper limbs before their lower limbs. So now on, of course, our head and then pababa. So that's cephalocaudal trend. Proximodistal trend is when a prenatal growth from 5 months to birth, when fetus grows from the inside of the body outwards. It also applies in the first months after birth, as shown in the earlier maturation of muscular control of the trunk and arms, followed by the hands and fingers. So motor skills from the center of the body outward. As you can see, the reason why it's this is the last time we have discussed when kids have na why do kids have problems with this one? Because when they were very young, from growth to 5 months, it's usually in the inside talaga. It starts palabas. Kaya later siya na-develop. That's why we have exercises for the kids that the height and weight development. It's normal for newborn babies to drop 5 to 10% of their body weight within a couple of weeks of birth. It is the adjustment to the neonatal feeding. Isn't it before they do not need to digest, they do not need to suck, and they do not need to swallow their milk, their breast milk, yung pain food nila. It was already there. Nandyan yan dun sa diretso sa pusod nila, and then the growth and whatnot. They do not need to do anything. They just need to grow. But when they are now being breastfed, they need to learn how to suck. It's either the nipples of their mother or the I forgot the nipples of the breast bottle, the bottle, okay? And they need to swallow. Kailangan nilang matutong lumunon. So it takes time. It takes time. I don't know if you're ready. This is also the same with dogs because I don't have experience with people. Unlike some of you, I am kasi I'm an only child. So when the dog, or usually cesarean dogs, it's the mother usually neglects the kid. So if you will have a cesarean, for example, your dogs will be in cesarean, um, it will really take time. Kasi sa tao, I think, even if you're CS, you still love your kid. Even if you don't know that, even if you didn't push it there, you have this, we have the instincts, we have the love and everything. We are a rational being, and we know it's our kid. So we will take care of the kid. But on the contrary, animals is not as complex as us. So for them, if they, some of them, pag hindi nila nakita na lumabas sa kanila, they will neglect their kid. That's why if your dogs will be in CS, it will take time. And as my case, hindi siya talaga nagpade. Nagpadede siya how sa pilitan. Okay, that's a problem. So I'm just lucky that I have another pregnant woman who's already pregnant dog who's already experienced this one. So it's really hard, and it takes time before the pups learn how to suck, especially if it is from cesarean. I yeah, CS section. So because it takes time. So it's normal na medyo papayat sila ng konti. But of course, but they're adjusted to sucking and everything, they will, of course, grow, grow and grow and grow. Height and weight, breastfed babies are typically heavier than bottle-fed babies through the first 6 months. After 6 months, breastfed babies usually weigh less than bottle-fed babies. Well, it is because of course the bottle-fed babies, they have aside from the nutrients that is needed to the body, there's additional nutrients na kasi syempre it is processed na, unlike sa ano, this very natural. So it's not common na it's common that they will be I'm not saying healthier, but rather they will be more big. Okay, so mas ano sila. And infant's length increases by 30% in the first 5 months. Now, the first 2 years of life are the spreading connections of dendrites to each other. So as you can see, more and more dendrites, more and more things that we've learned, more and more dendrites, more and more complex natin yan. Now, the brain development. Myelination is the process by which brain oligodendrocytes produce layers of myelin that wrap around the neuronal axons and act as a layer of insulation for the transmission of electric action. Potentials down to neural axon. I'm sorry, it's very technical, but it's just the process. Just remember, it's the same process ng pagganap. Newborn's brain is about 25% of its adult weight, and in the second birthday, um, the brain is about 75% of its adult weight. Now, motor development. So after ng brain development, isa sa tinitingnan natin is the motor development, the reflexes. Now, newborns have many reflexes which are automatic for survival. They are like that. They are they are that's part of the survival. So it's innate from them na mga ganyan. So, but of course, as a baby, many reflexes that are present in birth will eventually subside. Now, ano yun? Sucking reflex. It is when something touches the roof of an infant's mouth. Infants have a stroking suck reflex. So, bottle breast. So, suck pacifier to summer. So, sucking. Mahilig silang lahat na ilalagay natin, ang reflexes nila is suck. Okay? Kasi they need to learn how to suck because of but survival because they need to eat. Okay? Suck the breast, suck the bottle. Rooting. It is when an infant's cheek is stroked, the baby responds by turning his or her head in the direction of the touch and opening their mouth for feeding. Now, I believe na kayong mga 20 years old na estudyante ng Meneses Campus, pag may inilagay sa inyong bibig, hindi kayo nganga at isasak nyo yon. Hindi na gano'n, di ba? That's what it is. Kasi hindi nyo, alam nyo na in your brain na, di ba, pag hinawakan yung pisngi mo, ano mo ba? Will you suck it? Of course not. What you will do, ilalayo mo yung mukha mo. Hello? ba't mo nahahawak yung mukha ko? Parang gano'n, 'di ba? So, it's different. So, rooting reflex, wala na kayo niyan. Wala na rin kayong sucking reflex kasi marunong na kayong gumuya. Gripping reflex. Babies will grasp anything that is placed in their palm. Babies can also support their weight in their grip. So, yung nade-develop na sa bata na lahat ng pag nilagyan mo yung something yung kanyang kamay, sasara. Sasara kasi that is their reflexes. Curling reflex is when a baby's foot is stroked, the infant responds by curling his or her toes. And when the outer sole of the baby's foot is stroked, the infant will respond by spreading out their toes. Those are just reflexes. So, yun, part siya sa bata. Next, ito, the startle or moro reflex. It is also developed. Babies will respond to sudden sounds, movements by throwing their arms and legs out and throwing their heads back. Ngayon, of course, most infants na nagugulat, they will cry. It's normal. And they will proceed to pull their limbs back into their bodies. That is a very normal pag nagugulat ang bata. Gallant reflex. Ngayon kasi, di ba, hindi naman na kayo na pag nagugulat kayo, hi, gano'n na lang, di ba? Pero hindi kayo umiyak. Gosh, gano'n. Kaya minsan kung ano yung nasa isip na. I remember my co-faculty, ginulat siya. Hindi ko alam kung anong nasa isip ng aking co-faculty. Sabi, Avatar. Ha? Avatar? Parang alam, just, Avatar? Parang gano'n. So, sa inyo, wala naman kayo, di makaiiyak, di ba? Not, siguro nagugulat na lang kayo at naiiyak pag kunwari, if you're afraid of thunderstorms, may mga iba lalo na pag sobrang takot sila dun sa kulog. Kulog, ayan, kulog. Gallant reflex, it's when an infant's middle or lower back is stroked next to the spinal cord, the baby will respond by curving his or her body toward the side which is being stroked. Sorry, yon. Next, the tonic neck reflex. It is when infants who are placed on their abdomen, so nakatapa sila. Whichever side the child's head is facing, the limbs on that side will straighten while the opposite limbs will curve. Those are the motor development. Now, we have an approximate age of onset. So, in the 1 to 2 months, the whole set up steady. Okay, ito yung mga gross motor skill. Pag 2 to 3 months, the holds head and chest with arms during tummy time. Pag 2 to 3 months, sits with support. That's the reason why pag yung mga first time na mga ako talaga I do not like holding babies. I am very scared, a little bit scared. Hindi ko naman ito drop. I won't drop the baby. But for me kasi it's very delicate. But when it comes to 3 months, yung pwede mo na siyang, di ba, inuupo mo na siya na gano'n, kaya niya ng, hindi niya kaya mag-isang upo, but rather, medyo kaya na nila na nakasupport ka. Okay, so hindi kasi 'di ba ang baby baka naman newborn tas bigla mong ginanon, 'di ba? Hindi. So it's different. 3 to 4, ayan marunong na siyang rolls from tummy to back. 6 to 7, rolls from back to tummy na siya. 6 to 8, ayan, 6 to 8, ito na yung may medyo nakikipaglaro na tayo sa bata dito. Sits without support na siya, kaya niya na. Uh, 8 to 9, pulls towards standing position. 9, crawls. 9 to 10, walks with support. Ayan, holding hands. 11 to 12, stands without support. And 12 to 13, walks without support. Now, my dear students, why do we have these things? Kasi we have these things Okay, sorry po. So, bakit natin ginagamit, tinitignan to? So, we need to observe the kids. Why? We need to observe them kasi pag kunwari, let's imagine, 1 year old na yung anak mo tapos hindi pa niya kayang tumayo. So, you need to observe. Always observe your kids. Sabi niya, kaya nga, being a mother, it's really being a parent. Okay, wag na nating laging mother kasi alam ko, there are also some dads that are very hands-on with their kids. So, being a caregiver and a parent, you need to know, you need to study. Bakit? Kasi you need to check, teka nga, yung anak ko po ba ay kaya na to based on the standard? Because if hindi niya kayang gawin yan, there might be a problem that you need to address as much as early as possible so that they could do something. Okay? Not just this, please study, especially if you are pregnant right now, or you have brothers or sister, is so that we could detect it early, lahat ng mga problems. You should know how to research or ask. Hindi lang kasi yung hindi lang sa matatanda, kasi there are sometimes meron silang mga bagay na um after so many years of practice, hindi pala siya pwede. Okay, so like that, you always consult with your health professionals and researches na talagang totoo when you are taking care of it. So that you could check, teka, ang reflexes ba ng anak ko ay tama? Teka, ganito ba to? Ganyan. So it's very important to check these different things. Now, let's proceed. Sorry. Okay, motor development naman tayo. It is the fine motor skills. Skills that involves a refined use of the small muscles controlling the hand, fingers, and thumb. Writing, drawing, and buttoning. So sa pagbobotones, di ba? Isn't it that when you were younger, it's hard, especially the boys. Sa girls kasi yung pantalon, bihira naman sila magsuot ng pantalon sa girls kasi we could do leggings, we could do skirts. Lalo na ang cute kasi ng bata kapag naka-dress. It's easier for the girls na na mag na for example, 'di ba, may bata kang kasama, mas madali sa girls na naka-dress na lang sila or naka-leggings, so that if they will poop, it will be easier for you to assist. Now sa boys kasi, it's hard kasi you need to talagang nakaano sila yung shorts nila maliit, mahirap siyang isab. So, and for kids, hindi pa sobrang develop yung fine, kaya it's hard for them to have the buttoning. Hindi nila nahihirapan silang ibotones yung kanilang mga shorts. So they really need assistance kasi hindi pa sobrang firm, okay ng kanilang fine motor skills. And now, I remember there's a post on Facebook, sabi na gusto ko na bumalik sa kinder, color lang. Okay. So in kinder, it's true na color lang. Pero ba't may mga bata na nahihirapan? Because they need to practice coloring. Color. Kailangan nilang practicein yon na they will color in a straight line. Na they will color in the specific things kasi pinapractice nila yung kamay nila. And aside from that, writing is also another thing. It's hard for the kids to write kasi nga that's why they're using bigger color, yung malalaking kulay, and also bigger pencils, yung matataba. Kasi they're not yet into it. Hindi pa sila nakakapag-practice ng ganun. So what they will do, ayan, so nagsusulat-sulat sila. And imagine what if your name is very long. So imagine Dr. Jose Rizal's name, it's very long. Paano kaya siya nag-practice? I remember I also have a friend in elementary, ang pangalan niya is Justin Earl Daryl P. Salapare. That's his whole name. So imagine, it's very long. So it's hard for the kid to write it down. And I know some of you na nagbo-module na yung mga pamangkin, naiiyak kasi, ba't ba ang haba ng pangalan ko? Sana pangalan ko ganito na lang, boy, ganun. Boy na lang po sana pangalan ko. So isa yun kasi it's hard for them. So after 2 years, there is movements, hand rotation, and coordination of the thumb or the forefinger, medyo nag-i-improve na siya. Now, sensory and perceptual development. Newborn's visual is 10 to 30 times lower than the normal adult vision. But by 6 months, the vision becomes better. And now you will check, okay, eto yan, hindi na-detect. Before kasi yung mga bata, hindi na-detect na malabo pala yung mata. Ba't ka ba nandyan sa TV? Ganun, yun, yung mga ganun yan. Lalabo yung mata mo, kaya pala nandun sa malapit sa TV, hindi pala makita. Kasi may sakit pala, yung mata pala niya ay hindi ano. So you will also check din para ma-detect natin earlier the age. Now, there's a question, can newborns hear? Well, hearing develops much before the birth of the baby. It's when in the womb, the baby can hear it. The mother's heartbeat, the grumping of his or her stomach, the mother's voice and music, and infant's sensory threshold are somewhat higher than those of adult, which means that stimulus be louder to be heard by a newborn than by an adult. Isn't it that there are different studies na nagsasabi na you need to let your kids listen to classical music so that they will become matalino daw. Ayan, nilalagay nila sa tiyan nila. And there are also device in which you could play music, storytelling, tas nakalagay lang siya nadidikit siya dun sa tiyan ng mother. So that they could hear it regularly, tas kinakausap nila yung baby nila because it's part of it. Okay, so definitely the newborns can hear. Now, The next question, can newborns differentiate odors? Yes, but it takes several days. That's the reason why yung nanay nila, the scent of their caregivers or especially their mothers, kasi siya yung lagi nilang na ano. So they're very comforting. So they could feel, ano, pero it takes a little bit longer. Okay, can newborns feel pain? Of course, yes. Newborn males show a higher level of cortisol. It is an indicator of stress, so they could also feel pain. Now, can newborns differentiate taste? It might be, but it's still for further studies. Okay. Now, we are now in the cognitive development of infants and toddlers. There are four stages of cognitive development. So according to Piaget, meron tayong sensory motor stage. It is from the birth to 2 years. Pre-operational stage, it is 2 to 7 years. Concrete operational stage, 7 to 11. And formal operation stage is to 12 and up years old. Now, the sensory motor stage tayo, it is the first of the four stages Piaget uses to define cognitive development. Piaget designated the first 2 years of an infant life as the sensory motor stage. And during this period, infants are very busy discovering relationships between their bodies and the environment. So, syempre, they're very curious about everything. Everything is due to them. Yeah. Researchers have discovered that infants have relatively well-developed sensory abilities. The child relies on seeing, touching, sucking, feeling, and using their senses to learn things about themselves and the environment. That's why as adults, we keep on we keep on giving them different activities, colorful materials that they could play, that they could touch, and we're also um, um, letting them experience. Bakit ba lagi tayong pupunta sa park? Pag may bata po tayo sa park, pupunta tayo sa museums, we will go to zoos because we would like them to develop their sensory motor stage. So Piaget calls this a sensory motor stage because the early manifestation of intelligence appear from perceptions and motor activities. Through countless informal experiments, siyempre, it's hard to have a very formal experiments because they are using infants. Infants develop the concept of separate selves. That is, the infant realizes that the external world is not the extension of themselves. So infants realize that an object can be moved by a hand and develop notions of displacement and events. An important discovery during the latter part of the sensory motor stage is the concept of object permanence. So, ayan, we all have later we will discuss object permanence. Substages ng sensory motor stage, ayan. So, proceed tayo dito, pero ito lang. So, number one is simple reflexes. Simple reflexes, it's the first stage, the first months of life. It is the stage of reflex acts. Bakit? The innate response to external stimulation with innate reflex actions. When we say innate reflex action, it is already in Visit ka. Okay. It is already with them. So they're born with it. Okay. During this sub stage, the child understands the environment purely through inborn reflexes such as sucking and looking. For example, if you brush a baby's mouth or cheek with your finger, it will suck reflexively. Now, first habits naman. So we're already done with the secondary circular reactions. Dito naman tayo sa coordination. The fourth sub-stage is from 8 to 12 months. It is the stage of coordinating secondary schemes. Ano yon? Instead of simply prolonging interesting events, di ba nung una, nakatingin lang sila, nagsasak lang sila. Now, babies now show signs of ability to use their acquired knowledge. Tas nagre-reach na sila ng goal. For example, the infant will not just shake the rattle but will knock out. So, nung una, 'di ba may grasping period sila. Nag-grasp nila yung rattle, ganun-ganun lang sila. So, nasa-satisfy sila sa tunog. Now, what will happen is, nasasawa na sila sa puro natutunog lang. So, ngayon ba, ayan, nagsasimula na sila na parang ginagamit na nila yun parang na silang pusa, yung mga gamit, may binabagsak na nila. So, natutuwa na sila doon. Now, tertiary circular reactions naman. Children begin a period of trial and error experimentation during the fifth sub-stage. For example, a child may try out different sound or action as a way of getting attention for the caregiver. Now, the infant who once explored object by taking it now tries to put it back. So, for example, what will happen kaya pag ganito, pag ginawa niya? So, naiisip niya na yon. For example, it stacks the bricks. Okay, so, di ba, before mahilig ang bata manira, sira, tinanggal, tanggal. Now, little by little, that the kids will now that what will happen if I will put it back together. Okay, so that's another thing. Now, that is why during this stage, ito talaga yung binabantayan mo na yung bata because they they are curious. That's why I don't know, kasi sa Philippines, later na lang nauso yung pagbe-baby proofing. Ayan, 'di ba? Yung dati hindi naman eh. Basta pero sa ibang bansa kasi uso yung bini-baby proof nila since 90s. Yung mga kanto-kanto, nilalagyan nila ng kung ano. Eh ngayon na lang nauso 'yon. Lalo na ang dami sa Shopee ano. Pero dati hindi, kaya nga ang daming bata na aksidente. Oh, bakit may ano ka dito? Eh kasi nahulog ako nung ano, okay. So kasi ngayon uso na yung pintuan, actually ako may gate ako na maliit sa kwarto ko for my dogs, but that is for the babies talaga. Kasi nga bawal silang malundag. Eh ngayon dati hindi eh, 'di ba? So hindi kasi sa atin uso sa Philippines 'yon. Number one, because it's very expensive. Eh ngayon sa Shopee, may mga a little bit na hindi na sobrang expensive. Okay, so yung andador, okay, 'di ba yung andador ay napakadelikado din nun. Pero sabi nila ayaw nila nung gusto nila yung andador, pero ang andador kasi 'pag namali yung bata talagang tutumba siya. Okey, 'di ba ang laki nun, eh, 'di ba? So, yun lang yung problem sa'tin in Philippines kasi budget is very tight, okay, compared to other countries talaga. Now, the infant who once explored an object waiting apart tries to put it back together and is already done with that. So now, invention of new means through mental combination. Finally, this is the sub-stage 6. There is the beginning of symbolic thought. This is transitional to the pre-operational stage of cognitive development. So babies can now form mental representations of objects. So nag-imagine na sila. This means that they have developed the ability to visualize things that are not physically present. Ito na yung object permanence. Ito na yung nilalaro natin sa bata, yung peekaboo. Okay, yan, nagagana, bulaga, parang ganon. So they know that once they remove their hands and their eyes, nandun siya. So ito yung na nakikipaglaro tayo dun sa bata. And you know, what we're doing with the kids na nakikipaglaro tayo is very important to them for the cognitive development. So hindi nila, nakakatulong pala tayo nun. So na hindi na ako nakokonsensya dun sa asawa ng pinsan ko kasi while she was breastfeeding with my pamangkin, nakipaglaro ko ng peekaboo. So hindi ko alam na yung bata pala susundan. So ang ginawa ng bata, habang dumedede siya sa kanyang ina, kinagat niya yun, tsaka niya ako sinilip. So nagsigaw yung nanay niya. So tas tsaka ako umalis, parang walang nangyari. So gano'n dapat. Pero at least nakatulong ako sa cognitive development ng bata. Okey, so natatawanan ako, Sir Hiner. Huwag mo akong pagtawanan, sir. Okay, so 'yun. So object permanence is also part. So what we're doing with with our kids or with the pamangkin, it's important for their cognitive development and part siya sa object permanence nila. Okay? Now, learning and remembering. Infants and small children can do form memories. This includes both implicit memories, which are procedural memories, and which allows us to carry out tasks without thinking about them. So, an explicit memories like when we consciously remember an event that happened to us. Meron din silang infantile amnesia. It is an inability to recall events that happened when they were very young. Unless you are like Sheldon Cooper, sa young Sheldon na sabi niya, I remember everything that happened to me after my mom stopped breastfeeding me. So, hindi naman siguro ganun lahat. Meron kayong identical memory or photographic memory. So, hindi naman lahat. So, normally, we usually forget things. Although, there are times that it brings back. Parang may biglang, especially if it is very traumatic or very funny or it has an impact in our lives. Medyo minaalala tayo. But, most of the time, hindi. Okay? So, hindi natin naalala yon. Infants and small children sa language development naman, can do form memories. This includes both implicit memories, nasabi ko na pala yan, sorry. Okay, so there are different stages in the first language acquisition. So I know you're familiar with Noam Chomsky. I hope so. Pre-talking stage, it is the cooing. Okay, so hindi lang ang nagde-date ang may talking stage, pati ang bata. So according to Bollinger, pre-talking stage is cooing. So usually, vowel-like sounds lang ang kayang i-produce ng mga bata. So it is respond to sounds, turns head, eyes to search for speaker occasionally, some chuckle sounds. So for example, si Miles daw at the age of 4, he demonstrates cooing stage of language acquisition. Now, nagpo-produce siya ng u, o, o, typical. So, parang nagku-ku, parang ganon. So, they're trying to speak. Now, He still finds it difficult. Nahihirapan siya sa I, nahihirapan siya sa B, P, and M. Okay, so nahihirapan pa siya doon. Now, babbling stage, ayan, 6 to 8 months. So, babbling is the sound which infants produce as a consonant vowel sounds combination. Ayan. So, the sounds are produced by infants, but not all. The speech sounds are the same in language of the world, such as ma, mama, dada, baba, na. Okay, so this is the reason why this is yung mga tawag natin sa pangalan ng ating mga mother are usually like that because they're really the first words that the kid could pronounce. Okay, so yan. So dito pa lang sila nagsa-start na they pronounce words. Holofristic stage, it is 9 to 18 months. So defined holofristic from holo, complete or undivided, plus phrases or sentence. Ano yun? So holoplastic is the children's first single word which represent to a sentence. Children using one word to express particular emotional stage. For example, water. Sabi mo, water. Alam mo, okay, can you please give me some water? Ganyan. So, ma'am. Di ba ganun? Okay, ma'am is tubig. So, I don't know lots of baby languages. So, ayun, mga ganun. Papa. It could be papa is tinapay or food. So, but of course, the caregiver could already understand what what the kid is saying. Um, Aside from that, let's have the two-word stage. It is 18 to 24 months. Two-word stage is where the mini sentences with simple semantic actions. So ngayon, two-word stage na siya. So nadadagdagan na from the first word, dalawa na yung nasasabi niya. But of course, it means a big sentence to the kids na. Okay? We also have telegraphic stage. It is a very descriptive term because the child does not deliberately leave out of the non-content words as does an adult sending telegram. Um, I want to correct you kasi not all of us are familiar with Telegram. And Telegram kasi before, we are paying because ang sulat is not is it takes time before. So they're using Telegram. Like for example, imagine mo pag nagsulat ka na ate, patay na si tatay. So 'pag nakarating sa'yo 'yan, 40 days na nung tatay mo. So ikaw umiiyak pa lang sila naka-move on na kasi nga 40 days na. So now, Telegram before is used so that makakarating sa'yo within ilang after a day or two. Kasi ano lang siya, isang sentence lang siya na dapat ng maintindihan. Like for example, kasi per word yung bayad. So konti lang. For example, ibig sabihin at namatay yung tatay se-send mo din telegram, patay tatay, gano'n. So, naiintindihan na niya yon. Okay? Pero hindi siya isang sentence kasi nga per word ang bayad before sa Telegram. It's not the app that you're using right now. Ayan, yung mga mahilig mag-Telegram. Okay? Now, let's have 5. Telegraphic stage is merely descriptive term because, teka lang. Ulit yan. Umulit. So, sorry na. Okay, 6. Later multi-word stage is 30-month plus. According to Bollinger, at this stage, it is the fastest increase in vocabulary with many new additions every day. And also the reason, my dear students, if you are talking to your kid, as much as possible, talk to them like an adult. Wag kang, kasi nga, they are still learning the language, tas you are using their language. Hindi sila nakakadagdag ng language. I'm not saying that you talk to them with a very big words kasi mahihirapan sila doon, but rather give them at least a language that they could use. Okay? Para hindi yung gumaganon yung ano, yung paano matututo yung bata? Gumaganon-ganon ka, kinakausap ko yung bata. Tapos nagiging limited. No? So you could talk to them. What do you want to eat? Okay, very good. You want mom. Okay, then water. Okay, so yung ganun. You talk to them in a more convenient way naman. Okay? Now, language acquisition device, of course, is from Noam Chomsky. Noam Chomsky is very well known for this one. He is an innatist theory because he believes that the children have an innate knowledge of the basic grammatical structure that is the base of all languages. Lahat ng batang pinanganak, especially if you don't have a defect, you have the capability to speak, you have the capability to have the structure. Okay. And also, there's a critical period, essentials for the first language acquisition. That is the reason why during this period, this critical period, you need to involve you need to involve the kids talaga. As in, you need to involve them na magsalita sila, and you need to talk to them kahit nakakasawa because they're very boring, because of course the kids are still learning. The things that you've already known, it's first time to the kids. That's why um they're Mommy, there's a dog. Okay, so of course, ikaw nakakita ka na ng ilang libong aso, but this kid is still learning. So, ang alam niyang dog dun sa bahay ay yung si Brownie. Ngayon, nakita niya sa labas, ando si Tagpi. So, first time niya yun, Mommy, there's a dog, there's a dog. So, let's listen to them. Because let's talk then. Oh, very good. Oh, anak, what does the dog sound? Okay, para may ganun, what is the color of the dog? So we will help them. Okay, that's important for the critical. And during this critical period, if the kid is not talking already, you need to know why. Kailangan nating malaman yon kasi baka hindi na sila magsalita. We know that until 7 years old, pag hindi natutong magsalita ang bata, it will be hard for them. Okay? Okay, so kawawa naman si Angela, naubusan na siya ng load. Now, LAD explains how children, when exposed to any human language, are able to learn it within only a few years following birth. Now, it's good that as a Filipino major, you could teach your kid Filipino. You could also teach English. You could teach many languages so that they know they will be very adapt to it. Yeah. Chomsky argued that all humans are born with the knowledge of what makes a human language. Included in this innate knowledge must be details of important characteristics of all the world's languages. The term universal grammar has been used to describe the knowledge contained in the LAD. The process of language development is envisioned as one of which the child discovers which grammar rules contained within universal grammar. Now, my dear students, they would only know the universal grammar. Alam ko lagi yung niisip yung ma'am, ano po, yan po yung tamang sagot ng sa subject and verb agreement kasi maano po sa tenga. Yan po yung tama sa tenga. Magkakaroon lang ikaw ng tama sa tenga if you are exposed to the language. Like for example, you love watching English movies, like in Netflix, series, sanay ka. And also in written, also mahilig ka magbasa, alam mo yung tama because you are exposed to. That's why you need to expose your kids if you want them to learn more. Kaya nga may mga ibang bata, di ba, they love Peppa Pig. Hindi naman nagtatagalog eh. Hindi naman English yung nanay, but Peppa Pig, but ganun, but British English siya. Because the kid is exposed. Okay, now we are in the social emotional developments of infants and toddlers. So please read this one. So I know I already consumed 2 hours. So read na lang to sa bahay. So we also have attachment theory. So hindi lang kayo ang na-attach, pati din ang bata. Attachment theory focus on relationships and bonds between people, including those between a parent and child and between romantic partners. So meron din siyang attachment. So there are different stages of attachment. In birth to pre-attachment is birth to 6 weeks. Yung bata, wala siyang pakialam kung sino bumuhat sa kanya. But when it comes to 6 weeks to 7 months, the infant begins to show preferences to the primary, secondary caregivers. So, medyo may sinasamahan na lang siya. And 7+ months, infant shows strong attachment to one caregiver. And multiple, that's the time that this kid, parang little by little, he trusts other families. Now, it was said that it is the caregivers because that is not necessarily the mother or the father of the kid. Because, of course, you will form attachment to the person that you are close with, that you are with. That's the reason why, as a mother, it's really hard. Kasi syempre, lumabas sa'yo yan. You want it to be attached to you. But you have work. Isn't it? It's a problem. So, there might be a time that dadating sa point na hinahabol ng bata yung katulong mo or the caregiver mo or other people or sino man nagbabantay tapos ikaw ay hindi. Na hindi mo mapatahan yung anak mo pero sila kaya nila. That's one of the sacrifice of a mother or even the parent. Usually kasi ang father ay they are known to work. Okay? Si mother kasi ganun. But don't worry because at the age of 10 months plus, alam na nila kung sino yung nanay nila. Alam na nila kung sino yung tatay nila. And it will be easier. And of course, we must have a good bonding with our kids as well. Attachment is an emotional bond with another person. So Bowley believed that the earliest bonds formed by children with their caregivers have a tremendous impact that continues throughout life. He suggested that attachment also serves to keep the infants close to the mother, thus improving the child's chances of survival. Bowley and others propose that children are born with an innate drive to form attachments with caregivers. That is the reason why we are known that we are social beings. We are person and we are social beings as well. So throughout history, children who maintain proximity to attachment figure were more likely to receive comfort and protection and therefore more likely to survive adulthood. Through the process of natural selection, a motivational system designed to regulate attachment emerged. Now, what determines the successful attachment? One, behavior suggests that it was food that led the forming of attachment behavior. Siyempre, ikaw yung nagbibigay sa bata ng food, lagi kang nandyan kasi nga usually ang bata talaga they need food, so it's one of the major things natin. Now, I hope that you just read this is an example of a research then. So we have different emotional development. So, temperament. So, ano yung activity? So, ito na lang ang di-discuss ko. So, this is further reading na lang, hindi ko madidismiss. So, activity. So, definition, energy level, and amount of energy movement. There are some kids that prefer to be in motion. They're very active. But there are some kids are very dormant. They do sedentary children. Ayaw nila nang lagi silang nag-move. Ayaw nila ng ganon. So, yan. Aside from that, we also have regularity. So natural patterns and schedules for biological functions, for example, sleeping, elimination, and eating. So ang kids we have different routines. Now, there's some this is where you will do the toilet training. Like for example, okay, so anak, hindi ka na magda-diaper sa gabi ha, pero you know that para hindi sila mag-diaper sa gabi, you need to control the food, the liquids and solids intake ng may certain hours lang. So it would be predictable then. Next, initial reaction to new people and situations. Some children are very welcoming. Like for example, they saw this, yes, I'm so happy kasi nandyan yan. Pero may iba naman na they are not okay with different environments. Nagtotoyo sila sa mga matataong lugar, sa ibang lugar, so kasama yon. Adaptability, ability to adjust to changes. So sometimes when they're kids, it's easy for them to adjust to different routines, but there are times that kids, they hate different tasks. Na nagtotoyo sila kapag kunwari, hindi yun yung nangyari, nasanay sila sa ganon. Next, intensity, emotional response to events. Intense children are emotional in their responses, positive, negative. So, minsan may mga bata na sa emotional nila hindi sila masyadong attached. Okay, so it depends upon the students. Now, mood also, they're the typical emotional look. So there are kids that has a positive outlook, and of course there are different kids with a negative outlook as well. Distractibility, again, ability to focus. There are children who are easily distracted, and there are children who is not easily to be distracted. My dear students, this is one of the things that I've learned when I was being a substitute teacher um for elementary student, no, preschool. Okay, so one of the things that I've learned is a kid who has ADHD, it's hard for them to stay at one place, diba? So one of the exercise that they're doing for kid is this. So for example, meron kang bata. So okay, anak, you stay here. Let us count 1 to 10. 1, 2, 3, 4, 5, 6, 7. Basta mabago. 3, 4, 5, 6, 7, 8, 9, 10. A normal kid could stay. And a kid who has ADHD, it's hard. I remember when I found out, sabi niya, nagbibilang yung teacher. 1, 2, biglas yung bata, takbo siya. Hindi niya kayang magstay. Okay? So, but one of the thing is they are practicing that. Okay? So, little by little daw aabot yun, pahaba ng pahaba so that masasanay sila na mag-focus. Next, persistent is an attention span. So, ability to stay with an activity. Some children, pag sobrang complicated, they will not stay with an activity. But there are children na parang they could be longer and longer. Okay, so I hope your part of you can stay longer. Konting slides na lang tayo. Okay? Okay, sensory threshold. So reaction to sensory stimuli, texture, touch, brightness, volume, and taste. So there are children with high sensory threshold are more comfortable with sensory experiences, but there are, of course, naiirita sila. May mga children na naiirita. Of course, they are like adults, but they're not adults as well. So the emergence of moral self, a sense of morality, propose awareness of the existence of the standards. Now, this one, there's children who you should those children should recognize that there are entities and they are subjected to self-evaluation and self-description. If a student is not um do not know that they will not be trained, that they will be so that there is a norm, there is a standard, it will be hard for them. Para magiging mahirap silang kausap, magulo sila and whatsoever. That's why a responsible adult, we need to tell them there is a standard. Like for example, the kid is in the church, tayo ng tayo yung bata, maingay, umiyak. Dapat as an adult, you need to tell them, nak, hindi ka pwedeng maingay sa church. We are here because we want to pray. We are here and we need to respect other people as well. Okay? So kailangan dito matuto sila that there is a certain standard. Okay? Aside from that, when talking to adults, that's why tinuturo yun sa bata, you need to tell po or opo. But I think po and opo is just applicable to um not to every Filipino. Kasi may mga like I think sa Bisaya wala silang po and opo daw. But if you will omit that or the po and opo, make sure that they know how to speak with adults. They need to know how to share their ideas, ma-share nila yung ideas nila in a proper way para hindi sila magkakaroon ng problema. So, yun, tinuturo yan from the very beginning pa lang. Early infancy, of course, the birth to 6 months, it's not clear whether infants actually experience emotions. Kasi, ano daw, ang ginagawa daw natin, akala natin nakingiti. But actually, hindi pa siya nangingiti nung time na yun. Kumbaga parang ano lang siya, stimuli lang. No, not stimuli, but rather, ano tawag dito? Parang ano lang, hindi siya talaga nangingiti. But of course, we thought that the kid is smiling. 6 to 10 weeks, a social smile emerges kasi they could understand na. Okay, so natatawa na siya because marami na siyang nalaman. Like for example, many additional things has already been there. So action sounds, cooing, mouthing, ayan. So peekaboo, laughing, ayan, part of the cognitive development. Toddler is 1 to 2 years. So infants expressions of shame, embarrassment, or pride. Di ba sabi niya, pag nasa bahay, TikTok ka ng TikTok. Ah, bilis anak, anak, ikaw, sayo ka naman, sayo naman. Tapos nahihiya siya, tapos tatawa lang siya. Nahihiya, nagsisimula na siyang mahiya ng time na yun, pag toddler years. Toddlers know how to express their feelings, regulate emotion, express it using the language, and learn empathy. This is the time that we will help them learn this stuff. Now, Erickson's psychosocial theory, hope, trust versus mistrust is infant to 0 to 1 years because trust versus mistrust, this is the time that the kids will learn how to trust an adult, especially their mother, di ba? Ito yung diniscuss natin nung nakaraan. Now, autonomy versus shame and doubt naman is toddlers 2 to 3. Now, with this one, can I do things myself or must I always rely with others? So, nandito ka sa point in which that you are trying new things and you are thinking, can I do it? And imagine, dito kasing 2 to 3 years old, ito na yung dinadala natin sila sa mga playmates nila. So, they are now little by little learning, can I do this? Can I do that? Ayan, so isa yun. Now, before you leave, do you have any question? Ala? Do you have any question? May question po kayo?
Nagugutom na po sila.
Nagugutom na sila. Okay, sige. So before you leave our meet, if you don't have any question, I will not ask you naman to have a screenshot. Okay na yon, na-take naman na yung attendance. Type to the chat box, just one sentence, what did you learn today? And then you may leave the room. Okay? So yun lang. What did you learn today? Type it in the chat box before you leave. The class monitor will monitor your answers as well. Okay? So bago magutom si class monitor. So if you don't have any problems, so thank you very much. Just type down for your last recitation your takeaways. Okay? Goodbye, everyone. Have a happy lunch. And see you next week.
Thank you